So this video today, we're going over how to switch on your deep core muscle that's going to help you with your postpartum rehab in terms of your abdominal separation. So a little bit of anatomy. This is your skeleton of your trunk. The head goes up here. This is your pelvis and your ribs. So your transverse abdominis, which is the muscle that we're actually trying to switch on, very deep, wraps around your whole midsection like a corset. So it starts on one side of the spine, wraps all the way around to the other side, and attaches on the back in this big piece of fascia, and it attaches up onto your ribs and up onto your pelvis. So it pretty much covers this whole area, and when we're turning it on, we're trying to pull it all around and tension the tissue so that it keeps a nice strong back, supports the spine, and it's also going to tension the tissue that's in between your six-pack muscle, which is what we're trying to rehab. So we're creating a bit of pressure and tension through there in order to adapt and make the tissues adapt and hopefully bring your gap back together or strengthen that midsection. So we're going to go on to how to do the exercise. You can follow along, have a go, and hopefully get started on your rehab.
We start by lying on your back with your knees bent and a nice comfortable neutral spine. Place your fingertips in between your hip bones and lightly press. If you do a little cough, you'll feel the muscles underneath your fingers pulsing. This is the muscle we're trying to pull on. We're really thinking about drawing the two hip bones together so that when you're placing your fingers on that muscle, we're looking for some tension. This should feel like a slight bulge in the muscle with tension rather than pressing out using your breath. We also don't want to think about sucking in your stomach and just holding your breath in. Remember, trying to draw the two hip bones towards each other. It's really important that we practice this activation using our breathing. So we're going to inhale on the relaxing, exhale, engage, drawing the two hip bones together. Inhaling and relax, exhale and engage. Cycle through this motion and just keep practicing.
So once you've learned how to switch on that deep core muscle and integrate it with your breathing properly, which is a really important part of the process of the rehab, we're going to look at trying to add more load to that exercise, increasing the difficulty, progress the exercise so that we can strengthen those tissues and bring the gap back together, or just create a little bit more strength through the tissue. So sometimes, I've spoken about before, that the gap doesn't actually close, but we can make it really functional so it supports you during movement. So get started on your activations and then we'll go from there.